All right. Hi, my name is Jenny Tracy, and I'm the Marketing and Communications Director at Steele Memorial Medical Center. And I'm here today with Lincoln Bevers, who's our patient advocate. And what we're going to talk about today is why Press Ganey surveys are important, why patients should take them, and just give a little bit more information on how they bring value to you as a patient and value to Steele Memorial as an organization. So, Lincoln, the very first question I have is, can you tell us who is Press Ganey?
Yeah, thank you so much for doing this, first and foremost. So Press Ganey is a third-party vendor that Steele Memorial is contracted with. So that means that they, at random, select patients all throughout the facility at Steele Memorial, whether it's the hospital or the clinic, and send out, at random, surveys to patients to fill out and hopefully return to us.
So how do those surveys come? Like what format do they come in to patients?
Yeah, so they come both email and they also come in the physical mail. If you get it in the physical mail, just so you know, it is a thicker packet, but that is to your discretion if you are at random select.
So I received the survey in the mail or in an email format. Why should I, as a patient, fill out the survey? And how does filling out the survey benefit me as a patient?
So that's a great question, thank you. Well, the first and foremost, the most important thing is for us as an organization is that your voice as a patient in our community is heard. And by filling this out, regardless of what your feedback is, whether it's positive, negative, or otherwise, it benefits you as a patient because that means that how you feel gets to be impressed upon us at Steele Memorial, if that makes sense.
No, I completely understand. So again, I fill out the survey. I get my voice heard. How does Steele Memorial benefit when I turn my survey in?
Okay, so that's also a really great question because we as a organization want to make sure that if we're doing something right, that we know it and we can keep on doing whatever it is right that you felt that we were doing right. But also if you feel that something needs change, oftentimes we can't change unless of course we are aware that there's an area of change that is needed. So by you filling this out, again, your voice is heard. We take that into consideration, and it's very important to us. It's a very important part of my job as well.
Okay. All right. Well, after we gather that information, then we get the patient's feedback, positive or negative. Sounds like we're really encouraging everybody to take those surveys regardless of how they're feeling, and we hope it's all good, but sometimes those little tidbits of information are very helpful to us as an organization. What is done with those surveys after they're turned in?
So that's obviously the most important part of this is, asking that the community, when they get these surveys, return them. So every single week, I get a report that's generated from Press Ganey. They send me last week's data on patient satisfaction, and then I create individual reports for different department managers. And depending on the information, we utilize that to either affirm what's working or to shine a spotlight on what's not working and discuss within each department how we can improve or make better a service or the overall comfort and experience of the patient.
Okay.
I also take different aspects of patient comments. And by the way, I feel like this needs to be said. This is 100% anonymous. You are not required to put your personal information whatsoever, unless of course you want. If you wanted to be contacted, that's absolutely your prerogative. But it is 100% anonymous, so we never know who's responding. So I take all this various different information and we try to apply it in applicable ways.
Mm-hmm. So I have a story of how we have used patient satisfaction survey results in the past, and when we rolled out Press Ganey about 10 years ago, one of the first results that we started getting back from patients was regarding our pain scores and the overall comfort of staying on our surgical floors. And so from those results that we got, we formed a committee which was called the Pain Committee, and it really focused on how to reduce pain and pain scores and how to increase the overall comfort of patient stays. And so the committee got together several different department managers and staff got together, and we also brought in our volunteer team, our Steele Memorial Auxiliary. And the auxiliary was an integral part of us putting together a program, and what we brought was a patient comfort cart and quiet kits. And we actually still use the comfort carts and our quiet kits to this day. The comfort cart gets rolled out to patients. It has magazines, uh, crossword puzzles, Sudoku puzzles. We have coloring books, crayons, cards to play games. All of those different things to provide some distraction to patients as they're sitting there healing and recovering in patient rooms. And then we also have our quiet kits, and those include kits that have chapstick, eye masks to block out the light. We have a pack of gum, toothbrush, toothpaste, and all of that's there to enhance the patient's stay. A lot of times after surgery, patients can have dry mouth issues, and that pack of gum can really help ease patients' dry mouth and make the overall stay just more comfortable. And that's why just these little two things with a comfort cart and quiet kits is how us listening to your survey results can really be impactful, not only for our past patients, but really patients that come and stay in the future.
Thank you. Those are perfect examples of how your voice matters. So if you do get a survey in the mail or via email, I do encourage you to consider returning those so we can hear from you, because how you feel matters. Thanks so much, Jenny.
Yeah, thank you, Lincoln. We really appreciate you. And Lincoln's here as Steele Memorial's patient advocate. And if there's any questions or concerns that you have, or just the positive feedback that you want to give us and things
Absolutely.
that we can continue to doing right, let Lincoln know, and he'll be your advocate. Thank you.